Hello, this is Dr. David Greene, CEO of the Washington Pain Network. Today's topic is the top 10 ways to avoid the need for joint replacement. Over 1 million joint replacements are performed every year, with hospital stays typically being 2 to 4 days. For the knee, the average age of a joint replacement is 70 years, with 60% being women. Infection rates are about 1 to 2%. There's a small risk of a blood clot. Satisfaction rates are very high for knee replacements, about 90%. 85% of the artificial knees still work after 20 years. This is a quality of life procedure when you have a joint replacement. No one has to have one. It's not, life-saving procedure. Because the implants do not last forever, it is advisable to wait as long as possible to undergo a joint replacement. The implants are made of titanium, cobalt chrome, stainless steel, ceramic material, and polyethylene. Treatment option number 1 for helping avoid a joint replacement is activity avoidance. If it hurts, either don't do it or do it less. For instance, is it really necessary to play golf 6 days a week? Maybe cut back to 3, 4. Is it necessary to be a marathon runner? Maybe switch over to cross training with bicycling, swimming, that kind of thing. Treatment option number 2 is very simple, over-the-counter medications. These may include anti-inflammatories like ibuprofen or naproxen, Tylenol, and then glucosamine and chondroitin, which can be obtained at any health food store. They're very, very, very low risk, and they can actually help potentially decrease pain and increase joint cartilage formation. Treatment option number 3 would be prescription medications. This may include topical creams or maybe a pain patch, high-dose nonsteroidal anti-inflammatories, Celebrex, or short-term opiates for acute exacerbations of the pain. Treatment option number 4 would be a TENS unit. It's a battery-powered device about the size of an iPod. It emits a low-dose electrical stimulation through these foam pads that are placed on the arthritic joint area, and it can change the way the brain perceives pain signals with the small electrical stimuli put through the skin. Treatment number 5 would be weight loss. Less joint stress means less potential damage to weight-bearing joints. Losing weight with exercise may strengthen up the muscles around the arthritic joint, lessening pain. There have been a lot of studies coming out recently which show that weight loss can help lessen joint pain and help lessen the formation of osteoarthritis. Treatment option number 6 is physical therapy. This helps strengthening muscles around the joint, can take some pressure off the joint. It can relieve pain with some of the modalities such as ultrasound, electrical stimulation, phonophoresis. Stretching is absolutely crucial in these sessions as well, and it's also crucial that you obtain a home program, because you only go to physical therapy, 2, 3 times a week max. Treatment option number 7 is acupuncture. There have been several studies looking at acupuncture for arthritic joints, and across the board, they've shown beneficial results. So it's a very, very, very low risk procedure. The needles just barely go through the skin, and the results have been excellent. Treatment option number 8 consists of steroid injection. It's never been proven that steroids damage joint cartilage in humans. They showed that in small animals decades ago, but then it was never reproduced in larger animals or in humans. So steroids are typically given every 3 months as necessary. They don't alter the disease process at all. They give the good old proverbial Band-Aid with excellent pain relief pretty much over 75-80% of the time. Treatment option number 9 is called viscosupplementation with hyaluronic acid injections. These are made from rooster combs, believe it or not. Our joints contain significant hyaluronic acid naturally. It's like the motor oil of our joints. So the theory is that you provide the hyaluronic acid for pain relief, and it can help promote the formation of cartilage. So some studies show 65% good to excellent results for 6 to 12 months. There was one that actually showed 80% good to excellent results for over 6 months. So they've been very beneficial. Treatment option number 10 is the newest treatments, and this is regenerative medicine injections. One is called PRP therapy, which is platelet-rich plasma therapy, which involves just a simple blood draw, and then it's spun down, and then the part of it that has the intense amount of concentrated platelets is injected into the problem joint, and it's been shown to work very well. Stem cell injections may include bone marrow or fat-derived stem cell-rich injections, or the latest is amniotic-derived stem cell-rich injections. The amniotic is shown to be exceptionally low risk. It comes from the C-section of women who are consenting donors after a scheduled C-section. It's immunologically privileged, so it doesn't cause any rejection in the body and has an intense amount of concentrated stem cells. The outcomes with non-operative treatment are that most patients are able to delay or avoid the need for joint replacement. While most joint replacements end up fine, there's always a chance of complications, and it is a quality of life procedure. So for the knee, for instance, injections offer over 75% good to excellent results with the steroid or the regenerative medicine. The top non-operative pain management in Washington is through the Washington Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options. The average success rates overall exceed 90% with the board-certified award-winning pain doctors. Visit us online today at washingtonpainnetwork.com and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Greene with the Washington Pain Network. Your pain stops here.